Acupuncture myofascial lines, the shoulders and hips. What we see here is the back functional line, and these points are in the deltoid and are known to treat hip problems. Now, this back functional line, it includes the lats and the glutes, and so when we use the points that are in the deltoid, then it's going to be able to work at the more superficial levels through the lats and the glutes. However, with the hip, we need to understand the functional anatomy. There's hip flexors and extensors, like we see here with the psoas and the iliacus, the rectus femoris. These are the flexors. And then we have abductors and adductors, like the IT band and the adductors on the medial part of the thigh. There's also internal and external rotators, and we see the external rotators here. So the hip is a complex joint, and to get the best results, we really need to understand the functional anatomy. So let's take a look at the shoulder triplets again. So here we see them, and they can work great for problems where there's misalignment between the shoulders and the hips, or when the problems are in the glutes. So to get the best results when treating hip pain, we really need to understand these myofascial lines and how they relate to the meridians. We need to understand that some of the extensors are on the superficial back line, some of the flexors are on the superficial front line, and the lateral line includes the abductors. Similarly, the deep front line plays a role in the groin and in the deep pelvis structures. The spiral line is an interesting fascial line to consider. It tells us a lot about the connection between the hip and then the back functional line. Here we see the arm lines, and we've talked about how the deltoid points can treat problems in the hip, but at a more superficial level. And then there's other points that we can use on these various lines for addressing hip problems. So it's really essential to understand these relationships between the meridians and the fascial lines and functional anatomy if we want to get the best results that we can when treating the hips and the neck and the back and any sort of musculoskeletal condition. To learn more, visit ihsociety.com and watch some of the additional videos that I have that go into more detail.